Okay, today we're doing a video on toddlers and their development and their issues with falling. Uh, Toddlers are a really fun age until they start getting curious and they're running faster than their bodies can keep up and they fall. So, according to the World Health Organization, falls are the fourth leading cause of injury causing death in children. And at the toddler stage, which is between the ages of 1 year and 3 years old, they tend to be the largest fall risk out there. So as a toddler, their cognitive development hasn't caught up with their curiosity and their independence, especially by 2 years of age. So at 2, these toddlers are getting into things without cognitively being able to realize the consequences of their actions. So they can take that run down the stairs and across the yard and not think about that log in front of them that they're going to trip over and hit their head. They also get so curious looking out windows. That's another fall risk. And unfortunately has created many accidents in this age group. They also physiologically have heads that are larger than their bodies. So already they're looking into doing things that they don't know the consequences of. They're curious, they're independent, and they're off balance to boot. So in this video, what we're going to visit is how these injuries typically present in a toddler. Also, how is this injury treated, and what can we as parents or caregivers do to prevent these injuries from happening in the first place with this age group? Like I said, fun age, but very, very at risk for falls and injuries due to those falls. So I hope you enjoy our video, and we'll see you soon.
In this part of discussion, we continue to learn about the toddlers, the development, and how this age associated with the risk of injuries. Here we'll talk how the injuries from fall typically present in small kids. Fall injuries are common in toddlers. As we know, this age is characterized by a strong desire to independence, a natural curiosity to explore the world around them. So toddlers start moving around a lot. They don't want to listen, they wouldn't hold a hand, and caregiver not always fast enough to catch them from fall. The severity of the injury will depend on the height of the fall that happened. Same with the outcome. It would look different when falling off the bike or from trampoline, windows, or trees. Unfortunately, some injuries are mild enough we can just treat them with a hug and a kiss, where others will require a visit to the doctor's office or even to call an emergency. Anterior Injury Campus Journal stated that in 2016, for children aged 0 to 3, falls resulting from slips, trips, and stumbles, and falls involving a bed and other furniture, and also falls on and from stairs, steps, were the leading cause of injury. Where injuries to the head were most common in fall-related injuries, 68.8%, elbows, shoulders, 12.8%, were also significant, followed by small instances of knee and lower leg injuries, 8.7%, and injuries to the ankle and foot, 4.4%. We go over the most common presentations from falls for this age group. Scalp injuries. The scalp is the skin covering the head, and it contains many small blood vessels. Even a minor cut or injury can bleed a lot, so it can look more dramatic than it is. Sometimes bleeding in and under the scalp can cause a bump or swelling to appear on a baby's head, which may take a few days to go away. Scalp fractures are a more serious complication. The skull is the bone that surrounds the brain. It's possible for a fall from a high place to break it. Infants with a skull fracture may have a depressed area on the head, clear fluid draining from the eyes or ears, bruising around the eyes and ears. Take the baby to the emergency room immediately if they have any of these signs and if baby is conscious. Brain injuries. The brain is a delicate structure that contains many blood vessels, nerves, and other internal tissues. A fall can damage or injure these structures, sometimes severely. A concussion is a type of head injury that typically occurs when a blow to the head causes the brain to jolt inside the skull. It can be difficult to detect a concussion in a baby or toddler because they cannot easily tell a person their symptoms. Signs of concussion in an infant include loss of consciousness, inconsolable crying, vomiting, excessive sleepiness, prolonged period of quietness, temporary loss of recently acquired skills, irritability. Also, sprains, strains, and fractures can happen from the fall. The bruising, swelling, bleeding at the site will indicate affected area. It's also the best to be checked at the doctor's office. I included the links below for
Hey Mila, are you okay? Do you know what happened? Are there any areas that hurt? Did you bump your head?
Yeah. I have an ouchie on my head.
All right, yeah, you're bleeding. Okay. To care for a wound, you'd wash the area with mild soap and water. To stop any bleeding, it's important to use sterile cloth or gauze and hold on the wound for 10 minutes. Ice the area for 20 minutes using ice wrapped in a towel or cloth. Ice the area again after an hour to reduce any swelling or pain. When finding a child that has fallen, it's important to assess their level of consciousness and awareness. Assess alertness, response to voice, response to pain, and or unresponsive child. Look at pupil size, equality, and reactivity. Toddlers can be difficult to assess depending on their ability to talk. However, a family member will usually know if they are their usual self. Many times toddlers will fall with no serious head injury or will have a small cut or bruise, but it's important to know the signs of a head injury that needs attention immediately.
I'm going to be discussing falls in toddlers and the way that parents can help avoid or prevent those falls. So falls are actually the most serious injury that happens to toddlers. And the number one way of preventing falls is actually preventing them. So kind of pre-planning, preparing your house for it. So we'll be discussing inside and outside factors and things that parents can do to avoid falls. So toddlers at their young age still have a larger head size compared to an adult. So it actually makes them a bit more of a tipping hazard. So they're a lot more prone to tipping. And that is a huge reason why they tend to fall. So when you start looking around your own home, it's pretty surprising how many fall risks that you can find. So have a couple setups here that I'll kind of go through with you and show what we can do to avoid toddlers tipping. So chairs. Chairs in the home, obviously they're all over the place. This goes for regular chairs that you use in the kitchen. It can go for such thing as island chairs as well, and high chairs. So with the high chairs, you want to make sure that they have a nice wide base, rubber grips, make sure that they're, set up properly. And then with, a kitchen chair, again, making sure that, it's sturdy, it's got a wide base. Island chairs, teach your child that, these will easily tip. Maybe just remove them completely until they're a little bit older, because they like to climb. And if you climb on something like this, it is easily tippable. And then, of course, making sure that the chair is in good repair. So this is a bad example of a chair. This is actually part of the support beam here. So, if a child was to climb on a broken chair, obviously that's going to increase their risk of falls. The dreaded stairs. Lots of houses obviously are equipped with stairs. So the number one way that you can prevent toddlers from falling would be installing a safety gate at the top and at the bottom of the stairs, making sure it's nice and secure. You can also ensure that when the toddler is attempting to go down the stairs, making sure that the stairs are free of clutter. So as you can see here, there's nothing on the stairs. You can encourage the use of a handrail, and you can actually lower the handrail to a height that's appropriate for a toddler as well. And just kind of, watching out for things, an animal, a dog, cat, as the toddler is going down the stairs. If you have the stairs that have a door leading down to the basement, you can buy those doorknob covers to prevent the toddler from opening the door and falling down the stairs. Securing furniture as well is another way to avoid fall risks. And of course, again, constant supervision of the child. So I don't have my dresser secured, but if I was to wiggle it, it's quite wiggly. If a toddler was to climb up, up using the handles and pulling, not only would they have the dresser fall on them, but they would also have a very sharp, heavy object fall on them, as well as a mirror. So quite dangerous. So again, securing, secure the mirror, remove any heavy objects that could potentially fall on the child. So another safety concern with toddlers can be their bed. So it's actually recommended that children under the age of 6 do not sleep in a bunk bed. If you do have a bunk bed, make sure that the side rails are secure and installed properly. And of course, discourage the child from jumping on the bed, playing on the bed. Just kind of encourage it for sleeping use only. And then if you do have the bed set up, try to make sure, that furniture and things can kind of be out of falling areas, I guess, for the child to avoid them having further injury. You can see here on the nightstand that I have, there's sharp corners, right? So you can get corner guards or put some kind of padding on the sides of the corners if you do choose to have your furniture here. That's an option as well. Bathtubs are another fall risk for children. So obviously with toddlers, you don't want to leave them unattended at any time in or out of the bath. So if you can see here at toddler height, right, there's a big sharp edge of hard tile. So you obviously want to assist the toddler from getting in and out of the tub, and ensuring that you have a bath mat outside of the tub that has grips available on the floor, so that when the little one's stepping, right, the mat's nice and secure. It's not causing a fall risk. So you can see here a window. I'm fortunate enough to live in a house that doesn't have, it's not super high, but it would still, you know, could be quite dangerous if a little one was to fall through. So 5,000 toddlers in the US actually fall from windows every year, and it results in things like spinal injury, paralysis, and death, and 20 per year actually die from the fall out of a window. So they recommend that you keep your windows open no more than about 4 inches to allow airflow. Anything more than 6 inches, an average 5-year-old and younger can actually fit through. So I do have the windows that you can kind of adjust. As you can see, I can open it quite far, or I can close it to the recommended about 4-inch level. And then I have these handles here that you can actually remove so that the child can't open the window. So if you don't have those kind of windows, you can get window guards that actually will help prevent the fall from a window. And just to make a note that a window screen is not considered a safety advice. So just because you have a screen app does not mean that the child is exempt from falling through that window. Another area of concern outside the home would be playgrounds. So when you're at a playground, make sure that there's a shock absorbent surface, gravel, sand, rubber, and try to steer your child into using the equipment that would be more age appropriate for them. Outside, having them avoid slippery surfaces, teaching them not to run around pools. If it's icy, snowy, like where we live, making sure that they have winter boots that have a good tread. A fluffy out, coat can help cushion a fall as well. And then just teaching them to really use caution if they think that something is going to be slippery. And then the final thing that we'll talk about for outside is trampolines. So it's recommended that trampolines are not used whatsoever. If you are going to have a trampoline, ensuring that there is a secure net around it, maybe adjusting the height a bit so that it's not as high. And with the netting, just making sure that it's secured properly as well. So hopefully this video was helpful in ways that parents can help to avoid falls in toddlers.
I hope you enjoyed our video on toddlers and the risk of falling. References are in an attached document. Thanks.